Guys, COVID cases are soaring, so I wanted to go back and revisit what puts someone at higher risk for COVID-19 complications. We have talked about this numerous times over the last few months, but of course, as COVID continues to go on, we learn more and more. And actually, the CDC recently updated their lists about who's at highest risk. So let's jump right in because, by the way, this is one of the questions you guys asked me more than anything else. Okay, the first thing is age. We know that people who are older tend to have higher risk for COVID-19 complications. Okay. And remember back in the day, we'd say 65 and older, 65 and older, 65 and older is at risk for higher complications. Well, it's still the case that as we get older, we're at higher risk, but the CDC now no longer says like 65 and older as a hard cutoff. Rather, what they do is they indicate that basically the older you get, the higher risk becomes. In other words, at 50, you are at higher risk than someone who's 40. At 60 and 70, you are at higher risk than someone who's 50, and so on and so forth. And of course, people who are over the age of 85 have higher risk, right? And probably the highest risk than say people who are 70, 60, 50, 40, etc. So the idea is the higher up you go in age, the higher up your risk for COVID-19 complications goes. When we talk about COVID-19 complications, you're probably like, wait, what's she talking about? What's she talking about? What I'm talking about is people who don't do as well with COVID, right? We've often said that sometimes younger people do a little bit better. They may not be as hospitalized or have a severe illness. So we are talking about the people who don't do as well, who may end up in the hospital on ventilators, that may have very long protracted illness. So the first thing is age, and that's one of the things that the CDC updated on their website. Now, let's go on to the medical conditions, because this is something that you guys ask me a lot. You'll often write me and you'll say, hey, Dr. Jen, I have this condition or I have that condition. Does this make me at high risk? So let me read to you straight from the horse's mouth what the CDC says, who the CDC says is at high risk, okay? And again, this is for high risk for COVID-19 complications should one get COVID-19. Okay, let me read this list. It's relatively short. There are about 7 things on this list. The first is chronic kidney disease. If you have chronic kidney disease, you are at higher risk for COVID-19 complications. Number 2 is COPD, chronic obstructive pulmonary disease, or emphysema. Number 3 is an immunocompromised state or a weakened immune system from a solid organ transplant. Number 4 is obesity. Yes. Now this is big. Obesity is on this list of things that put you at higher risk for COVID-19 complications. That is huge, guys. And by the way, obesity defined as a BMI or a body mass index greater than 30 and higher. So keep that in mind. Number 5, if you have a serious heart condition such as heart failure, coronary artery disease, or cardiomyopathy, that puts you at high risk. Number 6, sickle cell disease. And number 7, type 2 diabetes, which, by the way, is a lot of my patients have type 2 diabetes. Guys, that's 7 conditions right off the bat that puts you at increased risk for severe COVID-19 illness. Children who are medically complex, have neurologic, genetic, metabolic conditions, or who have congenital heart diseases, those children are at higher risk as well, okay? So now, the CDC also has another list. This other list is for people who might be at increased complication from severe COVID-19 disease, okay? So that first list was people who we are pretty sure are at high risk. This next list is people who might be at high risk. Listen closely. It's a longer list, so I'm going to go a little bit quickly. Asthma. A lot of people have asthma. Those who have moderate to severe asthma may be at higher risk. Cerebrovascular disease. That's conditions that affect the blood vessels and the blood supply to the brain. Those who have cystic fibrosis. Those who have hypertension or high blood pressure. You guys ask me about that all the time. So if you have high blood pressure, you may be at increased risk for severe COVID-19 complications. If you have an immunocompromised state, neurologic conditions such as dementia, liver disease, pregnancy. Pregnancy is on this list for might be at higher risk. Pulmonary fibrosis, smoking. If you have thought about quitting smoking, this is the time to quit, guys. I am standing behind you 100%. Thalassemia, which is a type of blood disorder, and type 1 diabetes. Guys, this is probably not the full list. We are learning more every single day. By the way, if I said these things too fast, just go back and watch the video again. Take notes. Just remember that these are guideposts. You're probably saying, so what do I do? What you do is make sure that you're seeing your doctor regularly, following their advice, taking your medications, keeping your conditions under control, and being vigilant. Social distancing, wearing your mask. And if you're living in a state or a location where COVID cases are increasing, stay home. Take care of yourself. Guys, please share this video with anyone you think might benefit from it. Don't forget to like and follow my page. I do daily health videos. And if you're interested in sending stars, I answer your questions first. Guys, I'm Dr. Jen Caudle, and I'll see you soon.